Dr. Frances Ferguson. I'm an internal medicine physician in Albany, Georgia. I was asked to do this video because just of the incredible amount of misinformation there is out there about COVID and COVID vaccines. My organization is a federally qualified health center. We have almost 400 total employees. We have 28 sites and centers, and it's very difficult to get everybody on the same page. Some people are saying one thing about vaccines, some are saying something else about vaccines, but it's important for me as a clinician in the practice to make sure that everybody's on the same page so that the patients are all being told the same thing. We have to help patients make sense of what they are seeing and what they're hearing. We have to be trusted messengers. Our patients depend on us for that. I absolutely recommend that physicians not only read the factual information, but from time to time, they do have to go down those rabbit holes of misinformation and disinformation to see what our patients are being told, to see what they are believing, so that we know how to combat what it is that they are saying. It is really important for the team to be on the same page, especially within the same practice. So it is important for us to give the same messages. Even a little bit of conflicting information is dangerous for patients because you're leaving them hanging out there on their own to determine what is right and what is wrong. And patients should not have to do that. We activated a COVID task force. The individuals on this task force stayed abreast of the changing information because, as we all know, COVID changed by the day. Our staff was able to email the COVID task force or give a phone call to them and say, hey, this is what I heard. I'm confused about this. What is our organization's stance on certain things? And we did that so that everybody would be on the same page so that we could all give patients the same information. In the very beginning, our vaccination rate was less than 30%. And that was just abysmal for us. We're a medical organization and our vaccination rate is so low. So the first thing we did, we had a staff meeting. I was asked to present information on COVID vaccines because I've become somewhat of a guru in my organization. We got everybody together. I presented all of the data and information to them and told them about the importance of vaccines. And I think we went from 30 to 60 something percent vaccination rate. We implemented standing orders, and my practice is huge. We have over 28 sites and centers. Our director of nursing and her staff went around, they trained all of the nursing staff how to use standing orders. We need to educate our staff on the importance of vaccines. Important thing is education, 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 and reinforcement, because people forget. We have to keep talking to them. We increased our vaccination rates to up to 80 to 90% in some of our clinics, and we have maintained high vaccination rates even through COVID because our nurses kept using their scope of practice in order to use standing orders to increase vaccination rates. Our vaccination rate is now well over 96% in our organization. We need to make vaccines a priority in our clinics. We know that vaccines stop pandemics. The only thing that stopped smallpox was a worldwide vaccination program. The only thing that stopped measles was a worldwide vaccination program. The only reason we do not have any polio in this country right now is because of a worldwide vaccination program. So as physicians, nurses, front desk staff in the offices, the hospital staff, the nurses there, it is so important that we spread truthful information to our patients. So that's all we have for today's video, but we will be back with additional vaccine content in the near future. Be sure to like and subscribe to our channel here at the ACP. Click the notification button down at the bottom of your screen, and you will be notified when new updates and new videos are available.